Одним із важливих результатів відзначення 50-ліття Світового конгресу українців і приїзду до Канади, виконуючи обов'язків міністра охорони здоров'я Уляни Супрун, була її робоча зустріч з міністром здоров'я провінції Онтаріо Ерік Хоскінс.
There is already good cooperation, technical cooperation, as well as solidarity, strong support between Ontario and the Ukraine. And this meeting provides us with an opportunity, I think, to deepen that collaboration. So we spoke about a number of issues. We spoke about the challenges that Ukraine is facing in terms of reforming the healthcare system. After much discussion, I'm confident that the direction that the minister is taking is a good one in terms of the reforms that she's proposing and the government is proposing and implementing. And we, I think, zeroed in on or focused on 2 or 3 areas where we feel that Ontario and Canada, but Ontario particularly, can perhaps offer some assistance. So we spoke about how in Ontario we've utilized telemedicine, which is providing access to specialists and delivering healthcare services to small towns and remote areas, doing that through the internet and through telecommunications, through video links, for example. And we also talked about telehealth, which is a program we've had for quite a number of years. You might be familiar with it here in Ontario, where Ontarians, residents of this province, can call and speak with a healthcare professional and get advice. Maybe they have a child that wakes up in the middle of the night with a fever, and they can have a number that they can call Telehealth Ontario to get immediately to get professional advice. So those 2 measures, telehealth and telemedicine, might be tools that we can offer Ukraine and offer our support to see if that may help to improve access to healthcare and provide that important service to even more Ukrainians. And we also talked about emergency medical services. So it's critically important that populations have access to emergency medical services. So we're thinking ambulances, right? Emergency care like that through ambulances. And in Ontario, we have some of the best highly trained paramedics and dispatchers that work together to deliver that ambulance service. And so I'm hopeful that in that area as well, and you can see that they're all sort of linked together to focus on improving access and improving the delivery of care, that perhaps on emergency medical services we might have an opportunity to provide some support.
Minister Supron, you've basically turned everything upside down in Ukraine in terms of healthcare. You mentioned right now also that pharmaceuticals are being asked for the first time for some kind of accountability. What's the reaction of the industry aspect of healthcare to what you're doing, but also specifically doctors? How are they falling into line or not? And then the general populace or patients, to what extent are people welcoming what you're suggesting, or to what extent is there skepticism? This will never work in Ukraine?
Well, Ukraine is the capital of this will never work. So that's something that will happen all the time, because there have been so many attempts. There's been 22 ministers of health and 23 attempts at healthcare reform in 26 years in Ukraine. We are the first that have been successful. And why were we successful? Because we actually spoke to the doctors and we spoke to the patients and we got their input into what we're doing. We went through an entire policy dialogue when this started. We started with the cabinet of ministers, with the prime minister himself, and the cabinet of ministers introduced what the reform bill would look like. We then expanded that to parliamentarians, the governors of each of the regions, and the mayors of the cities. Then we did a tour and we visited every single oblast. We spoke to over 10,000 people, both healthcare professionals and patients, and we had their input into what we're doing in the healthcare reform. Once we put all of that together, that's when we put the concept forward. forward, and afterwards we put in the law. 72% of Ukrainians, when we started, we had some polling, social polling done. When we started, only about 30% of Ukrainians supported the healthcare reform that was happening. In the summer of 2017, that number went up to 72%. What is not popular? What is not popular is that right now, over half of the healthcare financing is in the gray zone. It is cash, not taxed, not followed. Nobody knows how much it exactly is, but the World Bank estimates that about 7% of GDP is spent on healthcare, of which only 3% is actually paid for officially by the government. So that is a very large amount of money that is in the gray zone, and there's some people making a lot of money off of this system. They are not happy. The pharmaceutical companies who had free rein are not happy. There is quite a number of those established systems that don't want to see any change. And the ones that are really the most unhappy are the oligarchs, because when you keep people poor, unhealthy, sick, and have a poor education, they're easy to control. They're easy to steal from. They're a very controllable population. Once you start giving them an education through reform, once you start giving them health care and making them healthier, once you start giving them a decent pension, they now start becoming more aware of what it is to live in a mature nation state and a democracy. They no longer will be so easily controlled. And those which control most of the TV stations in Ukraine are very much against what we're doing, because we're giving people the power to choose and to be healthy and to be able to have disposable income on what to spend on, and to get information from the internet, and to have choices. And that's not very popular for those who don't want to see Ukraine have those kinds of things. Our neighbor to the northeast is also very unhappy with what's going on. And how do I know this? Because my husband works on this program called Stop Fake. So they identify fake news, and they talk about why it's fake. They show the real news. And once I started appearing very commonly in those fake stories, I knew that we must be going in the right direction, because we're making
You're
them
getting
upset.
You're a real modern Joan of Arc here.
As you know, Ukrainians are very close to Canadians, and especially everybody knows Toronto and everybody knows Ontario. So introducing anything from the Canadian healthcare system, especially from Ontario, I think will generate a lot of trust in Ukrainians. And I think that that's important. You know what else that you can do as the Ukrainian community, the Ukrainian Canadian community? When you talk to your relatives and when you speak to them, you need to explain to them how the system works in your country, and you need to say that this is why it needs to work the same way in Ukraine. You can make a difference, each and every one of you, when you put this in your Ukrainian newspapers, but call on your readers and call on those that are watching on television to talk to their loved ones about the system that you have in Canada, how good the system is in Ontario, what is telehealth, what's telemedicine, how does emergency work, and let them know that this is a normal process that's happening, that this is a good system, and that it will improve healthcare for all of them.